So we have over 45,000 appointments within our outpatient areas, Redcliffe Hospital. On average, patients previously would queue for up to 30 minutes to get to a front reception desk and then be asked to go and take a seat. So by that point, they were quite upset. Some of them were quite frail. Standing in a line, waiting to get to a front reception desk to go through a whole heap of information was a huge issue for the patients.
For me, the most important thing is patient flow. When I'm looking at 180 to 220 patients per day, I want to make sure that there is that efficiency for patients so that we are able to give them a good service.
Investigated whether we could have the opportunity to have something which was a little bit unobtrusive to the patients, but also easy to use, interfaced directly back to our patient administration system and allowed for an automated approach for patient arrival, but also to check details and update financial information that's required for a hospital visit.
Patients can arrive through a kiosk system which they're familiar with because most of the shopping centres now have them. So that's been a great benefit to us. They're familiar with this technology, so they scan their letter and they're automatically directed to the appropriate waiting area. Patient
confidentiality is one of the most important things in a hospital setting, so to ensure that we had a higher level of patient confidentiality was one of the big aims of the whole implementation of this project. Previously, patients would line up, go to a front counter in front of maybe 30 or 40 patients and talk about personal information. What the kiosk system allowed us to do was actually have their information displayed only to them while they're at the kiosk without other people around. So that has certainly increased our patient confidentiality, which has been a huge success for the hospital. The accuracy of our data has increased. We have much more accurate data at the end of the month to report to our corporate office and to our government to make sure that we get our funding correctly. For one clinic alone, in 1 month we raised an additional $22,000 in revenue for patients who were from overseas, so they would actually, previous to implementation, be directed to take a seat, and that collection of money was never performed. So that's been an increase in our revenue and it's just raising continually.
We can streamline the service so the patient generally would have been taking 3 hours to see the doctor, plaster, x-ray, it's now down to about an hour and a half. Now, as a result, patients are happier. They're coming in, they're having their appointment, they're able to get on with their day.